Hi everyone, welcome back. My name is Brandyn Dunn and I'm a facial plastic surgeon here in beautiful Newport Beach, California. Today we are going to be talking about buccal fat removal. Buccal fat removal is a hot topic and I want to make sure that you understand all of the ins and the outs of buccal fat removal before you decide to book your consultation or book your procedure. So let's get into it. Buccal fat is one of the deep fats of the face. It's between the high cheekbone and the jawline. It's not very forward, it's not lower by your jowls, it's not close to your mouth. It's really between your high cheekbone and your jawline. Not everyone is a good candidate for buccal fat, and the reason is because everyone's face changes differently over time. So one of the big questions that I always like to ask my patients to see if they are a good candidate is whether their face shape kind of dictates or is more like one of their parents, more like their mom or more like their dad. So the big thing about this procedure is that if this procedure is performed in someone that is not a good candidate, then that will give you the kind of negative connotation or the thing that's going around all of social media, basically the gaunt, aged appearance. So if you are pretty thin, you have a relatively thin face, then this is not the procedure for you. Or if you're going to be thinner or your face is going to be thinner as you get older, more like one of your loved one or your family members, then this is probably not the procedure for you as well. If you are bothered by fullness or heaviness in that area, or you feel like you have a fuller or rounder face, then you may be a good candidate for buccal fat removal. So it's really important to make sure that you go to a surgeon that understands facial aging, facial volume, and whether you are the right person to perform this procedure on. The reason why buccal fat has a bad rap and a lot of people are afraid of it is because surgeons kind of come in and patients request this procedure and they just perform it all willy-nilly. Yes, willy-nilly. And if you do that or someone does that, then that is ultimately where we see these bad outcomes. And so it's not a bad procedure. It's just the wrong procedure for the wrong person. My approach to this is relatively conservative because I believe that I don't want to necessarily over sculpt or over contour your face. And so I essentially what I do is I get access to the buccal space. The buccal fat generally, if you have excess buccal fat, comes out pretty easily during the procedure. And then once it comes out, I kind of take whatever the body gives me. I don't try to manipulate it too much or tug or pull or try to really kind of pull too much fat out. My big thing is making sure that I'm just kind of taking what the body gives me, the extra fat that is there, and then leaving the rest behind. That allows for safe results, that allows for natural results, and that really is kind of my approach and what I believe is to be the best approach for this. Let's talk about the procedure. So this is a relatively straightforward procedure, and oftentimes it's performed in the office. It can be performed in conjunction with other procedures like liposuction, a deep neck lift, or any other procedures kind of to help with facial contouring. And so the way I perform this procedure is through two small incisions on the inside of your mouth. These are hidden incisions that are not seen by anyone, and they heal up beautifully in no time. So through these small incisions, I'm able to get access to the buccal fat. Ultimately, removing that fat allows me to kind of give you that definition and contour between the high cheekbone and the jawline. Like I said, this procedure can be performed in the office. I would say relative downtime is about 7 days or so, 5 to 7 days. Everyone's a little bit different. It's very normal to feel some scar tissue afterwards, which happens in the buccal space. Kind of feels a little bit firm in your cheeks. Oftentimes people will get some swelling after the procedure that will last for about a week, maybe up to 2 weeks, depending on how much you swell. Most people don't have much bruising related to the procedure, but overall it's pretty well tolerated. And then let's talk about the post-op care. After the procedure, I want to make sure that you take care of these incisions and your overall mouth oral hygiene really, really well. The chance of infection is very, very low if you take care of your incisions and take care of your oral hygiene, but it's something that you got to think about. So oftentimes I prescribe antibiotics after the procedure. I will give you an antibiotic mouthwash to kind of rinse your mouth after the procedure. I have you do that twice a day for the first week. And then anytime that you're eating or drinking after this procedure, I want to make sure that you kind of rinse your mouth out with clean water. That allows you to kind of get rid of any sort of buildup along the incisions and make sure that everything stays nice and clean and healthy. Another thing that's really important is to make sure that you advance your diet slowly. So don't go out immediately after the procedure and eat a big cheeseburger or a Snickers bar. That really kind of defeats the purpose and is going to cause a lot of tension and pulling on your incisions, lots of chewing. So in the beginning, kind of advance your diet slowly. Start with some thin liquids, start with smoothies, start with shakes, start with something that you can kind of soft foods, much easier and much more well tolerated. As you feel more comfortable, as that kind of swelling and mild discomfort gets better, then you can start advancing your diet more kind of appropriately. Fortunately for this procedure, most people don't have a lot of discomfort. I'd say maybe the first night you're a little bit uncomfortable, maybe have a little bit of difficulty getting comfortable, but after that, most people don't have much pain or discomfort at all. So if you do have pain or discomfort, or you do have significant swelling after the procedure, it's really important to make sure that you contact your surgeon, you give me a call. I give all of my patients my cell phone number, and I want to make sure that they feel comfortable and they feel like they can get in touch with me if they need anything. And the big thing is bad things don't really happen very often with this procedure, but if they do, they need to be intervened with quickly and as soon as possible. Results after buccal fat vary from person to person. I've had some patients where you see results almost immediately after the procedure. It's pretty impressive. But I'd say most patients, it takes several weeks and actually up to several months. And so what to expect as far as the results? I would say it's not something specific that you see on your face where you're like, this is exactly what was removed and this is exactly what I see. I would say the general consensus is most of my patients say that overall their face feels much thinner and much more well contoured and defined. And this is because it's a deeper fat of the face. And so it's not something where you remove something very close to the skin and then you see an immediate result. And so that's kind of something to understand throughout this process and understand that everyone's results are a little bit different, but overall, most people are super happy with this procedure, and it's overall something that everyone wishes they had done sooner. So if you're thinking about having this procedure done or you have questions about this procedure, I think it's really important to make sure that you see an expert in this area, to have an evaluation, to have a consultation. It's really hard to tell whether you're a good candidate just based on looking in the mirror, kind of answering some of these questions. I think that getting a formal consultation is crucial to making sure that you go to the right person, you find the right surgeon, you can trust them, and make sure that they'll take good care of you throughout that process. So if you have any other questions about buccal fat removal or any of the adjunct procedures that I love to perform with it, leave them in the comment section. I'd love to answer those and create some more future videos about that. Anyways, I'll see you guys soon.